Hello, everyone. My name is Kristi Hudson, and I'm the Vice President of Business Relations at ChiroHealth USA. Thank you so much for joining me for Risky Business. Wherever two or more shall gather, thou shalt not talk about fees, but we are here to talk about financial compliance when it comes to what you're charging in your practice. Um, Before we get started, let's talk about how did I get here today? I work for Dr. Ray Foxworth, who's a second generation chiropractor. He's been in practice since 1985. Um, and just like you, he can remember those patients, the first patients that ever walked through his door when he opened up all those years ago. And one of his early patients that he was treating was a family. It was mom, dad, and two kids. And they didn't have insurance, and they came into his office for years. But because they didn't have insurance, he was charging his cash fee. Until several years into that relationship, Mrs. Jones was in an automobile accident. And as you can imagine, he began billing his actual fees for the services he was providing to her insurance company. And one day when she was in the office, he walked into the treatment room. And you can immediately tell something was off, like that you could just feel the tension in the air. And so hesitantly he asked, Mrs. Jones, is everything okay today? And she walked up to him and she had that EOB in her hand and she said, Doc, it's guys like you overcharging insurance companies that prevent me and my family from being able to afford insurance. And so that day she left. She never came back into the office. Um, we don't even know if she ever received chiropractic care again, but what we do know is that she reported him to his board of examiners and to the state attorney general's office. Um, because again, she felt like he was committing fraud by charging more to the insurance company than she had been when, or he had been when she was a self-pay patient, which led him to discover the five most dangerous things we find when we are really assisting with practices. But these are the most common mistakes that happen when it comes to billing, coding, and charging in offices. And the first one is his Miss Jones story. It's when you're charging more to insurance than you do to your self-pay patients. It misstates charges to your carriers. In fact, it absolutely violates those provider agreements that you signed with the insurance companies. It can also be a potential False Claim Act violation. And you're going to see that with these five things that there's a little bit of overlap. And often that's where we find that you have these massive, insane fines that make tremendous headlines is because they didn't just get in trouble for one, but for multiple infractions of these five most dangerous things. The second is improper time of service discounts. So time of service discounts are discounts that are based on bookkeeping savings, meaning if I come into your office today, there's an expectation that I will pay today. And if I pay today, then you're not having to send out an invoice or billing statement to collect at a later time. And the OIG, the Office of Inspector General, states that a 5 to 15% discount is considered reasonable. But what we find when helping provider offices around the country is that we'll have a doctor say, oh no, I only offer like a 10% discount. Well, it was 10% 10 years ago, but in that time, the fees have gone up, but our time of service price stayed the same. And so what was once possibly a 10% discount is now 20, 30, 40, even a 50% discount, which now is a cover for a dual fee schedule. Inducement violations. The OIG permits incentives of up to $15 per item, but no more than 75 annually. And this violation actually has a civil monetary penalties of up to 10,000 to 50,000 per wrongful act. And some good examples of this would be offering free or discounted exams, x-rays, or therapies. So as you're thinking about this, I want y'all to think about like social media specials, $49 new patient special, $99 new patient special. Those could be considered an inducement violation. Simply putting, that does not apply to federal patients with federal health plans, does not get you out of being in trouble for a potential inducement violation or anything else that we're talking about today. It could also be, free or discounted services for referring patients, which can also be our next thing, which is the anti-kickback statute, which prohibits paying or receiving any type of remuneration to induce the referral of government-paid healthcare business. So that's for the federal anti-kickback statute. Many states have their own anti-kickback statutes as well as inducement statutes. The anti-kickback statute is a criminal law. It is a felony punishable with a fine of up to $100,000 and up to 10 years in prison. It also has civil monetary penalties, which include $100,000 per kickback plus 3 times the amount of the kickback, the remuneration. So I want you to think about this. Again, what about giving away free or discounted services, free massages, or a free adjustment for referring a friend? Waiver of copays and deductibles can be considered a kickback as well. So you just want to be careful in what you're offering to your patients, because a lot of times people think of it as, well, it's typically a business to business transaction, maybe even from provider to attorney, attorney to provider, but it can also be from the provider to the patient. And last but not least is the False Claims Act. You know that every single claim you submit, you hit the little button for your signature where you're attesting that everything is true and accurate. This one is also a criminal statute now, and it has civil monetary penalties of anywhere between $14,000 and $28,000 per false claim. It is, you can go to jail for this one and face criminal fines. Examples would be upcoding for higher reimbursement, downcoding for self-pay patients. Waivers of copays and deductibles are also considered a False Claim Act violation. According to the DOJ, healthcare providers should be familiar with the government's expectations, which is the 3 fundamental questions regarding compliance programs. Is the compliance program well designed? And I beg to start with, do you even have a compliance program? And I do not mean a 3-ring binder that still has the plastic on it somewhere in the vicinity of your front desk, right? Is the program applied earnestly and in good faith, as evidenced by the fact that it is adequately resourced and empowered to function effectively? Did you take the plastic off? Are your employees familiar with your compliance program? Do you provide compliance training? Does the compliance program work in the practice? You know, the Department of Justice and the OIG expect that you have a compliance program and that it is an active, living, breathing thing. Compliance is not something that is one and done. It is something that has to be evaluated regularly, trained on regularly, and updated regularly in your practice. And it is just a requirement of being part of healthcare, for being a healthcare provider. The only thing more regulated than healthcare is the environment and financial services. And I want you to think of like Wall Street, banking, things like that. Those are the only things more regulated than healthcare. So the reality is, who cares what you charge? And the reality is, everybody cares what you charge. And as a taxpayer in this country, as a provider, you should care, because healthcare fraud costs $308 billion annually. It is very expensive. And I apologize. Like, this is what happens when you have to reformat slides. But as we're going into talking about elections, which this is not a political thing, but here's what consistently happens anytime there's some national election, whether it's for federal office or president. There are 2 things that get talked about: national debt and healthcare, every single time. And I bring up national debt because I don't even know what that crazy number is at this time. But the reality is every potential president brings it up. We're going to tackle it. I don't know that it's ever gone down. So we just talk about how the country is broke, 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 broke. But here is what we have seen, is that our government spends millions, hundreds of millions of dollars into healthcare fraud investigations. And the reason they do that is because it is a cash cow. It is a cash cow because for every dollar they invest, they are recouping a significant amount of money, as high as $7.10 in some years, and it's been as little as $2.92 in others. So I want you to think about this. Let's just say, oh, I'm sorry, $2.80. But let's just look at the 2024 numbers. It was $3.46. Well, in comparison to $7.10, doesn't really seem like it's that much money. But I want you to think that's a 346% return on investment. If I told you that for every dollar you shoved into the screen in which you are watching this presentation on right now, it spit out $3.46. How many dollar bills are you shoving in there? As many as possible. And that's exactly what the government is doing. And that investment has they've been investing in AI technology for years so that they're able to detect healthcare fraud significantly faster. So what used to take months, even years, now can take a matter of hours and at the most days. Over the years of talking about this and teaching about this around the country, it's interesting. I have heard every possible workaround to get around the federal government and state government and all the rules and regulations that say what you can and can't do in practice. And one of my favorites is that, well, we're just not going to charge anybody. I have a lot of feelings on this, but we're not here to talk about that. But we're not going to charge anybody. So there's actually a case where a doctor in Iowa decided that he wasn't going to charge anyone for STEM. Some insurance covered it, some didn't, Medicare didn't. So he really loved utilizing STEM in his practice, believed his patients really benefited from it. So he's not going to charge anybody. He's going to put it at $0. Well, the problem is that this is an actual service. This is a service that has a value. And if it has a value and now we're not charging for it at all, what are the potential things that we've already talked about that it could be an issue? Well, what about an inducement violation? Could it be considered a kickback? And in this case, it was considered a false claimant. Actually, in this case, it was considered all three, but I digress. All because he chose not to charge for a service, not a very expensive service, a nominal service in his practice. And in the end, it cost him $79,919. Now, that's great because it could have been significantly more, as we've already learned. But one, he didn't have to admit guilt. And because he didn't have to admit guilt, he was not kicked out of federal health care programs. And I'm not just talking about Medicare, I'm talking about Medicare, TRICARE, Federal Blue Cross Blue Shield. There's tons of federal health insurance. Wasn't kicked out of any federal health insurance programs. As a result of that, he wasn't kicked out of other health insurance programs. Now, I will tell you that to defend this case and to get this incredible deal, it cost him about $250,000 in attorney's fees. And for years, we've been telling people, do not offer free services. Hear me when I say this. My fee is my fee and nothing is free. My fee is my fee and nothing is free. You know, in the South, we talk about four-letter words or bad words, most of them. Um, and the like cash is a four-letter word. That's a dirty word, cash fees. But free, you know, the worst words begin with F, haha. So free is the worst of the four-letter dirty words. Don't give away anything for free. So one would think that after years of teaching this, we would be past the point where I'd still have to be talking about this. But listen to this call that took place only a few weeks ago.
Chiropractic, how can I help you? Hi, good morning. I'm calling from Mississippi, and my husband and I are going to be coming up there and spending a few months this summer. And I wanted to find out what it would cost for us to see a chiropractor when we come up there for those few months. We go every other week because we're a cyclist and a tennis player. And I just wanted to find out what you guys typically charge for a new patient, for an adjustment, for regular maintenance. Do you have any kind of pricing on that?
Yeah, absolutely. So our first visit to the new patient would be 100, and then all follow-ups are 60.
Okay, and do you file insurance, or is that your out-of-pocket cost?
That's the out-of-pocket cost, yes.
Okay.
So we par with certain insurances, most of the major state ones.
Okay.
I'm not sure what insurance do you have in Mississippi.
Well, we have United Healthcare, but we're about to max out the allowable visit, so we'd be paying out of pocket when we're there. So, do you offer electric stem?
Yes, we do.
Okay, what is the charge for the stem?
For the out of pocket, if you're paying self-pay, you don't charge extra for it.
Okay.
So it'd just be within that 60.
Very good. All right. Thank you so much. I'll look into setting up an appointment as we get closer.
No problem.
Thank you for your help. Bye-bye.
You're welcome.
Woo, there's a host of issues. I hope y'all heard them with this call. And I just want to let you know that Not every single person who calls your office is a potential patient. In fact, it could be an auditor, an investigator with an insurance company or a state or federal government. So how your team answers the phone matters. Your state boards care. There are state board rules and regulations that govern what you can and can't do. And then again, I'm a nerd. And so I just love all the people who serve on the state boards. I love hanging out with them. I love reading board reports, and I love asking them a million and one questions about all of the cases and things that are brought to them. But what was fascinating to me is that one of the number one reasons for complaints to boards of examiners is over patient finances. Mind blown. Seriously, it's over patient finances. Case in point, there was a doctor in Mississippi. He had a patient who did a prepaid plan. She did not finish that prepaid plan. Shocker, because that happens quite a bit. And when it came down to the refund, there was a disagreement between them. They couldn't, she thought he owed him $100 more than he thought he did. So she files a complaint with the Board of Examiners. 13-hour board hearing. So here's what happens. It does not matter what triggers an audit or an investigation, whether it's your Board of Examiners or the federal government. Anything that it is discovered in the course of that investigation, you are subject to fines and penalties for. At the end of this 13-hour board hearing, he did not owe her any money. In fact, he was correct. He did not owe her the $100. But what did come out was that he failed to collect proper copays, was waiving deductibles. It was written in his office policy. Present at that board hearing was a representative from Blue Cross Blue Shield and the state attorney general's office. So yeah, he didn't owe her $100, but he closed his office for what would normally have been a 12-hour day of treating patients. And can you talk about the post-payment audits that came afterward? And in fact, he got in trouble for his Board of Examiners, not over the refund, but for the dual fee schedule and the waivers of copays and deductibles, was put on probation for 2 years and paid $10,000 in fines and penalties. So whose rules should you follow? Because there are multiple entities from the boards of examiners all the way up to the Office of Inspector General who make rules and regulations that you are responsible for knowing and understanding. And state laws do not supersede federal rules and regulations when it comes to charging fair market value or gifts and inducements. And I'll give you a really great example. If any of you are from North Carolina, the Office of Inspector General, that would be the big daddy right here, says 5 to 15% is a reasonable time of service discount. But in North Carolina, the state Chiropractic Board of Examiners says that a 30% time of service discount is considered reasonable. So whose rule do you follow? And I would love to tell you that that's like just the only example I have of when there is conflict between state and federal rules and regulations, but there's not, even from your insurance companies and the federal government in some cases. Here's the deal. Whatever is the strictest rule, that's typically the one that I would follow. And why do we have to stay on top of this? Because the reality is audits are on the rise. And it's interesting to me. I know you guys aren't students, but I mean, I speak at chiropractic colleges around the country. And one of the things that students tell me often is that they're not going to treat Medicare patients because the risk is too big to be audited, which is so crazy to me because the reality is Medicare only makes up less than a quarter of the audits that take place. Commercial payers actually make up the largest chunk of audits and investigations. Now, let me tell you, as I'm the person who gets Google alerts, notifications from FBI.gov, and boards about fines, penalties, audits, and investigations. Let me tell you, the most sensational headlines are in this 2% range. They rarely happen, but man, are they great to read. Great examples of what not to do. And it's not always chiropractic. Most people fall under $100,000. Now, just like the one that we talked about in Iowa, it was $89,000. That's typically what happens. There are $0 to $100,000. That is still devastating. It is just easier to do things the right way. And part of that has to do with, I'm so sorry, the formatting stinks here. Part of that is making sure that you have a process for doing, following up with records requests, because believe it or not, this is like the spot check, the pop quiz. This is its own audit. What was interesting about this one and is not so uncommon these days is that it's asking for patient financial records, which has nothing to do with proving medical necessity. But wait, there's more. Do you offer your patients any discounts or special offers? If yes, how are these discounts and special offers reflected on the claims submitted for reimbursement? Hey, newsflash, there is no place on a claim form for that. This is a trick question. Do you currently accept insurance payments as payment in full? Now, I have to give it to Aetna because they tell us what they want to know. Do you waive copay, coinsurance, and or applicable deductibles for your patients? The reality is we give this job of dealing with these records requests to the newest person in the office who doesn't really know any better. And they may not even know how to answer this question because we added this to an online survey with over 1,000 doctors and CAs replied to the survey. And when asked the question, do you currently accept insurance payments as payment in full? 99 point who knows what percent, but almost every single person answered yes. Now, if you answered yes, it asked a follow-up question. Do you waive the co-insurance copay and or applicable deductibles for your patient? And almost everybody, not everybody, but almost everybody said no. Now, if you answer this question incorrectly, are you going to get hit with these crazy fines and penalties we've talked about? Probably not, but it is going to open up a much bigger audit into your records. And whatever they find in the course of that audit, you are subject to fines and penalties. Because if you shine a bright enough light in anyone's office, you're going to find mistakes. We are human. This one is really to me, do you offer your patients any discounts or special offers? Again, every day on social media, I was just in New Jersey this past weekend. The first thing I do when I get off a plane in any new city or state when I'm speaking there is I open up Instagram and Facebook because it's going to show me chiropractic ad after chiropractic ad after chiropractic ad. And I'm just screenshotting them. And I'm not just saying just because New Jersey, a few weeks before that. Oh goodness, where was I? I can't even remember. I'm traveling all the time, but it doesn't matter. I do this in every single city and state I go to, and I screenshot all these crazy ads. You're offering a $29 new patient special. Well, was it worth it? I don't think so. Because these fines and penalties could equate to over $200,000 from one records request. And the crazy part is that inflation has hit because 10, 12 years ago, this would have been under $100,000 in fines and penalties. The only way to answer this appropriately is to say the only time we offer a discount is when it's required by mandate, by contractual agreement, or documented hardship. And it should be listed in your financial policy just like that it says we only have a single fee schedule that applies to every patient for each service provided. What does that mean? It means that if my 98940 is $100, if they're PI, it's 100. If it's work comp, it's 100. If they Blue Cross Blue Shield, it's 100. If they are cash self-pay, it is $100. That does not change. The only way you're going to pay less than that is because we participate in your health plan. Are you a network provider with a health plan? If a state or federal program with a mandated fee schedule covers you, PI, work comp, Medicare, Medicaid. If you're a member of a discount medical plan like ChiroHealth USA, for patients who are uninsured or underinsured, where you can set up a legal and compliant discount in your office to offer those patients to make care more affordable. Oops. Sorry. If you're eligible and choose a payment plan that offers for a prompt pay discount, I'm thinking like another one of your TRP partners, Cash Practice. This is where they would come in. Patients who meet state and or federal poverty guidelines or other special circumstances outlined in our hardship policy, as in it's its own separate policy. If you have more than that in your financial policy in your office, please scan this QR code. This is a Word document. You don't have to give me your name, your email address, nothing. It literally is a download. Download it, adjust it to fit your practice needs. So again, I'm going to say ChiroHealth USA, that's who I work for, offers you a legal and compliant way to offer discounts in your practice. We become another network discount. So I want you to think of it like this. You have your actual fee, which is my 98940 is $100. Next, you have your contractual fees, which might be Blue Cross Blue Shield, which means maybe you charge $100, but they're only going to pay you $45, right? How are they able to do that without it being considered a dual fee schedule, inducement, and all of those things we talk about? And it's because of the contract that you signed, and now it becomes a contractual network agreement. ChiroHealth USA is another contractual network agreement. The difference is we don't set that level of discount, unlike Blue Cross Blue Shield, Aetna, Cigna, which tell you what you're going to get paid. We work with you so you can set your own level of discount because there is a fine line. We want to make care affordable for your patients. At the same time, we also want to ensure that your practice is profitable. Um, Being that we've worked with over 7,700 providers nationwide, we have access to all of these fee schedules in 49 different states. And it's really funny, in a recent project that we were working on and comparing actual fees versus market value for those providers, we found that almost 100% of providers do not charge market value when it comes to exam fees. Over 90% don't even charge market value for adjustments. And one of the biggest complaints that we hear all the time when we're traveling around the country is insurance doesn't pay me what I'm worth. Insurance doesn't pay me what I'm worth. Insurance, they undervalue our services. They don't undervalue our services. We undervalue our services. This is why other healthcare providers get paid more than we do, is because they're charging market value when we don't. Why don't we do that? Because we're trying to make care affordable for those patients who have limited benefits, no chiropractic benefits. Or they could be like when my kids were under the age of 12 and chiropractic wasn't covered for them, those kinds of situations. Well, that's why we have ChiroHealth USA, where you can set that level of discount to make care affordable while maximizing reimbursement when it is available. To have tons of resources for you, especially when it comes to setting up your hardship policy, making sure that's legal and compliant, making sure you establish your fees so that they are at market value, so that you are maximizing reimbursements and profitability when it's available. One of the really great things about working with providers nationwide is that we statistically see that the average chiropractor who joins ChiroHealth USA increases their revenue and profitability by over 20% in the first year of utilizing us. The other thing is patient retention, which is so huge. And again, we've worked with several of your partners like the Smart Chiropractor, Patient Pilot Project, and with Cash Practice. And, they both talk about the importance of retention, retention, retention. Well, ChiroHealth USA patients 50% renew year over year after year when they become part of ChiroHealth USA, which means that 50% of them are still with you a year later when it comes time to renew their membership. Now, there's no cost for you as a provider to become a part of ChiroHealth USA. There is a cost for the patient because we are a network, but it's $49 a year and it covers them and all of their legal dependents. So even if they are John and Kate plus 8, or the Duggars with 20 kids and counting, literally, if they can claim them on their taxes as a legal dependent, they are included in that membership, and it is good from 1 year. So if somebody signs up today on May 19th, 2026, then it's good through May 19th of 2027. And then they're eligible for the discounts. There's a lot of flexibility because not all practices are the same. We're working with your coaches to better understand how to support that profitability and progress that you're making. So reach out, schedule a call with a member of our team, and we'll be happy to talk to you to see if ChiroHealth USA is right for you. Thank you so much.